The Oculus Pentacam has revolutionized anterior segment imaging and diagnostics. The ability to visualize and measure the posterior float of the cornea is an invaluable resource to us as clinicians. I was recently involved in a patient case where the value of the Pentacam was highlighted. While refracting the young adult patient, I quickly noted that he had a large refractive shift since his last refraction just 1 year prior. I made the decision to proceed with anterior segment imaging and initially obtained a classical topography image. The image looked slightly abnormal, however, I could not give a definitive diagnosis of a corneal ectasia from the data it provided. The patient had a complex medical history, so I wanted to be certain of a diagnosis before adding to his already difficult situation. I moved over to the Pentacam, knowing that the information it could give would help me to diagnose the problem. The Pentacam revealed characteristics consistent with keratoconus. This diagnostic tool allowed me to make a quick diagnosis and send the patient for the appropriate treatments, including both scleral lenses and corneal cross-linking. Even during the scleral lens fitting, the Pentacam information was utilized to ensure the most appropriate initial scleral lens was chosen. With the advent of corneal cross-linking, the benefits of early diagnosis of keratoconus cannot be understated. The Oculus Pentacam allows us to achieve that early diagnosis. This example is only scratching the surface of the vast benefits the Oculus Pentacam provides to our patient care. The Pentacam can be beneficial in myopia management as we monitor for changes in axial length, as a screening prior to performing PRK or other refractive surgeries, and to monitor for corneal edema and thickness changes, just to name a few. As the scope of optometry progresses further and further, the Oculus Pentacam will be a vital asset in our toolbox for anterior segment disease.